What's going on, everybody? Tony Maritato here. So in this video, I want to talk to you about a hybrid model of a outpatient rehabilitation clinic. It could be PT or OT or speech. And basically what I'm looking at is those of you who already have a successful cash-based practice, but you want to expand that practice, you want to dip a toe in the world of Medicare, but you're not ready to take that leap personally. Maybe you don't want to get yourself credentialed or you don't want your clinic to be credentialed, but you're looking for a way to tap into the Medicare market, help the beneficiaries who really need your help the most, get them out of those high volume corporate clinics. What are your options? So I'm going to cover one scenario today. I call it a hybrid model, bringing a Medicare provider into your clinic. Let me show you what I'm talking about. All right, let's begin. So a hybrid version number one, because we're going to go through a couple different versions, not all today. Today, this is just about this exclusive model. You already operate some form of direct pay, cash-based, out-of-network clinic, and you're doing well, but you want to expand the scope of your clientele. You want more people to have access to the level of service that you provide. You want to grow the cash-based side of your business, and you want to use Medicare as a lead generation tool to bring those beneficiaries into your office. You and your business would remain unaffiliated with Medicare. So you are not getting credentialed. You're looking to find a clinician who does want to be Medicare credentialed. Maybe they already are. Maybe from previous employment, they already have their PTAN and they're ready to go. They will then decide if they want to be par or non-par. And essentially what you're doing is you're creating a partnership with this other clinician. The clinician's going to come in and they're going to rent space within your facility. So you need to have space that they would be able to use. Most typical would be a private exam room that they could have access to. You would establish a lease that gives them exclusive use of that space. It doesn't have to be 24 hours a day, 7 days a week. You could have a lease in place that gives them exclusive use of that space, maybe Monday, Wednesday, Friday, between the hours of 8 a.m. and noon, and then again between the hours of 2 p.m. and 6 p.m. Whatever you want to do, they just need to have exclusive use of the space they're using to treat Medicare beneficiaries. That clinician would have their own personal PTAN. If they decided to have their own business, their corporation, they could get a group provider number. This way, if they wanted to expand their business with partners and multiple owners, they could. But the idea is that they would be the credentialed body renting space inside of your facility. You would be able to provide them billing and collection services. You would be able to provide them some basic administrative services. The payments from Medicare would go to that clinician or their business, but then you would receive the income for the services you provide. So it's still a win-win scenario for both sides. The pros, the benefits of a model like this. Obviously, it helps improve access to Medicare beneficiaries, both for the beneficiary getting access to you and your services, but then also for you getting access to those beneficiaries without violating any federal laws. It helps clinicians who want a greater opportunity for independence and autonomy, but don't want to take on the commitments of full-time business ownership. There's a lot of us out there who did not go to school to become business owners. We just love treating patients. And so if you have the successful business model already and the business know-how and acumen to run a business, then this might be the perfect marriage between that clinician who's a step above the rest, but does not want to take that leap into business ownership. And obviously this increases the ability for you to bring in Medicare beneficiaries into your continuity program, your wellness, your fitness programs, the stuff that you offer already that these Medicare beneficiaries would benefit from. Now, it's not all roses, right? There's always a downside. So first, finding the right therapist. It is so difficult in this environment to find a clinician that matches your company culture, a clinician that wants to head in the same direction as you, and a clinician who finds an opportunity like this exciting enough that they're willing to take it. You're looking at starting a whole new business model in the form of offering billing and collection services. Now, you don't have to offer those services, but I think that's a huge upsell to attracting the right clinician to say, look, we have all the infrastructure in place. We can submit your claims, we can post your payments, we can do your accounting, we can invoice your patients, we can do everything you need done. All you need to do is do what you do best, which is treat Medicare beneficiaries. Obviously, you need to stay, even though you're not credentialed, you need to stay current and compliant with Medicare guidelines and regulations. You need to be able to change and expand your existing business model because now you're moving into new waters. It's not just about being great clinicians anymore. Now you're actually looking at managing a tenant. This therapist who's Medicare credentialed coming into your facility, they're a tenant. You have a lease in place. You have responsibilities as a landlord. You might not have intended nor want to become a landlord, but you'll find yourself in that position. And of course, you're bringing in a new clientele into your business. And so you need to think about, protecting the culture that you've created and making sure that although you're looking to move into the world of Medicare beneficiaries, that is a very large world with lots of different kinds of personalities and different kinds of people. So you just want to make sure that you're protecting what you've created. Other benefits. Let's go back to the good stuff. Having a credentialed clinician on site provides you with a lot of opportunities. Now you have somebody in your office, even though they're working for themselves and independent, they're in your office with the ability to objectively evaluate and assess new clients for medical necessity. Remember, there is a very clear definition within the CMS guidelines of what is medical necessity, what is a covered service. And so now this clinician has the opportunity to evaluate a typical client who's being referred to your business and determine, okay, what services are medically necessary, what are not, what could be included within this plan of care that is a covered service reimbursable by Medicare, and what is in this plan of care that is a non-covered service that the Medicare beneficiary is allowed to hire you and pay you a direct pay, self-pay cash rate. There is a lot of opportunity having this individual. Of course, it builds stable and lasting referral relationships with local physicians because it's just so much easier for them to refer their Medicare beneficiaries. And you're building a new dimension to the existing direct pay services that you offer. When you're looking at your ideal client, your ideal avatar, I started my business down in Sarasota, Florida on Siesta Key. The net worth of most of the residents on Siesta Key was well over $10 million. They were looking for a certain culture and a certain experience that I was able to deliver. And I was the only one on the island available and able to deliver the experience they wanted. These were high functioning, high level Medicare beneficiaries. They were golfing, they were playing tennis, they were living independently. We weren't working with a very medically complex demographic. And so with that, most of the services that we were able to offer were truly beyond the scope of covered services, beyond the scope of medical necessity. The evaluation, the plan of care, the assessment, all within the scope of covered services. But, helping a geriatric individual with shoulder pain hit the golf ball 30 yards farther is not a covered service that's medically necessary. And that's what so many of our clients were coming to us for. It wasn't just about pain. Pain was a symptom, but we all have pain. I wake up with pain after a hard workout. I'm sure you experience pain. When you dive into the Medicare regulations and the guidelines, the policy manual, you'll see that it says in there, diagnosis alone is not enough to determine medical necessity. And it goes through all the criteria. So that's for a different topic. My goal here is to just explain the fact that having a credentialed provider on site allows you the opportunity to clearly um, evaluate the individual walking in the door and determine what are covered services and what are not, what you're able to provide as a non-credentialed provider and what must be provided by a credentialed provider. And even if you were losing money on the Medicare side, because reimbursement isn't going to be what it is on a self-pay rate, but there's a reason why businesses use loss leaders to get those customers in the door. Once you have a lifetime customer, you have to look at the lifetime value of that customer, not just the initial loss on a single episode. I always look at it as, instead of spending $1,000 on a Facebook campaign, I'm going to spend that money bringing these clients into my clinic, because I know once I get the right mixture, the right fit between client and provider, that's going to be a client for life. And I'm going to be able to help them improve the quality of their life. So you want to see the numbers on what something like this would look like, right? Because I've talked to providers that are charging $200, $250 for the evaluation, $200 for follow-up sessions. And when we're talking about Medicare reimbursement, being down around $120 for the initial evaluation and maybe $95 after the reductions for a typical 4-unit follow-up session, it seems like there's no way you could provide the level of service you want to provide at that price point. But this is where the numbers make the difference. And so if you want to see the numbers, I'm happy to share them with you. We'll do it based on the Medicare allowed amounts. We'll do it based on, out-of-pocket reimbursement and what your charges are going to be. But I've got a couple rules. If you want to see the numbers on paper and you want a spreadsheet, I need you to subscribe to this channel. I need to grow this channel to more than 1,000 subscribers. I want you to ring the notification bell so you get notified every time I post a video. I'm trying to post 3 a week. I want you to post a unique comment on YouTube, not in Facebook, because the comments and the engagement are going to help me grow this channel so I could provide more of the information that you're looking for. And if I get 10 new comments, that's not a lot. If I get 10 new comments, I'll release the second video, which shows the full financial breakdown and projections, at least on paper, of what a program would look like. So guys, thanks for watching. If you want to see more examples of hybrid models where Medicare par or non-par providers can work with totally unaffiliated providers in a union that decreases the barriers to access, increases patient satisfaction and outcome, let me know. I'll keep sharing as many practice models as I can come up with, but I want to hear from you guys first. I'll catch you in the next video.